Everyone, today we're going to talk about the circle of Willis, the structures that form the circle of Willis, as well as the path and the origin and some of the branches of the main two arteries that form the circle of Willis, which are the internal carotid artery and the vertebral artery. First, let's have a look at the structures that form the circle of Willis. The circle of Willis is a connection between the interior blood supply of the brain and the posterior blood supply of the brain. It's really important because the brain is a vital organ and we need to have a blood supply that is unique in structure that can maintain the blood supply to the brain even if some branches are thrombosed. So this is the importance of the circle of Willis and why all the arteries are connected together, so that there are collateral blood supply that will always maintain blood supply to all regions of the brain, even if one of them gets thrombosed or clogged. So first of all, this is the circle of Willis. Circle of Willis contains let's start from the vertebral arteries. The vertebral arteries here, this is the left vertebral artery and another right vertebral artery connect together to form the basilar artery. Okay. And then the basilar artery will divide into two posterior cerebral arteries. So until the posterior cerebral artery, this is the posterior blood supply of the brain. Okay, then here in the interior region we'll meet the middle cerebral and the anterior cerebral, and we'll see how the interior and middle will connect to the posterior cerebral. Okay, before we get to the interior part, let's talk more about the posterior blood supply. So the posterior blood supply has the posterior cerebral. Okay, now we have three arteries that give blood supply to the cerebellum. Okay, the cerebellum needs three arteries. They all come from the posterior circulation. Okay, two of them come from the basilar artery and one of them comes from the vertebral artery. Okay, so the first one that comes from the basilar artery is this one. It's the superior cerebellar artery. It's hard to point. The superior cerebellar artery, okay, comes from the basilar. And then we have two inferior cerebellar arteries. Okay, the anterior one, so the anterior inferior cerebellar artery, comes also from the basilar. This is the anterior inferior cerebellar artery. Okay, and then the last one, which is going to be the posterior inferior cerebellar artery, comes from the vertebral. So this is the posterior inferior cerebellar artery. Okay, now let's go to the interior circulation. Okay, interior circulation is supplied by the internal carotid artery. Okay, it gives off the middle cerebral artery. Okay, and it gives off the interior cerebral artery. Okay, And these are the two end branches of the internal carotid artery. In a while, we'll talk about the branches and the pathway of the internal carotid artery, but until now, let's know that the two end branches are the middle and the anterior cerebral, okay? Now, where is the communication between the anterior part or circulation of the brain and the posterior circulation of the brain? This is the posterior circulation of the brain, right? Composing of the posterior cerebral and the basilar and the vertebral and the cerebellar arteries. And this is the anterior circulation of the brain, consisting of the anterior and middle cerebral. So the communication is here. It's the posterior communicating arteries that come out of the posterior cerebral arteries, okay? That communicate with the internal carotid, right? And then we have an anterior communicating artery, which communicates the anterior circulation of the left and right side of the brain. Here, it's this small section that connects between the two anterior cerebral arteries. So this is the circle of Willis. Let's talk about the internal carotid artery, its pathway and branches, and the vertebral artery as well, pathway and branches. Okay, so let's start with the vertebral artery. It originates from the subclavian artery. It's a branch of the subclavian artery, and then it ascends within the cervical transverse foramina to enter the cranial cavity through the foramen magnum. And then the main branches that it gives off are the posterior inferior cerebellar artery and the basilar artery. Let's get to the internal carotid artery. Okay, so let's go into the internal carotid. The origin of the internal carotid, we know on the left side, it's a direct branch. On the left side, the common carotid is a direct branch of the aorta, and then it bifurcates into external carotid and internal carotid, while on the right side, the aorta gives the brachiocephalic branch, which gives the right subclavian, right common carotid, and then the right common carotid will bifurcate into the right external and the right internal carotid. So here we have the left internal carotid artery. Let's see its pathway through the brain and the branches that it gives off. The internal carotid is special in its anatomy, so it's divided into 7 segments, C1 to C7. Each segment will pass by a special structure in the brain, and some segments will give branches, others will not. C2, 4, and 6 will give off branches, as well as C7. So it's easy to memorize that the even numbers will give off 2 branches, and then C7 is an exception and will give off 2 branches as well. And then at the end, the internal carotid will end as 2 end arteries or end branches, and we'll see them together. So basically, this is the internal carotid artery. It enters the brain through the internal carotid, the carotid opening. The carotid opening is in the sphenoid temporal bone, in the temporal bone, in the petrous part of the temporal bone. It enters through the carotid opening and into the carotid canal. The carotid canal is in the petrous part of the temporal bone, as we can see. This is the carotid canal. So here it's clear. Here is it enters the brain through the carotid opening and into the carotid canal, right? So the first segment is the cervical segment before it enters through the carotid opening, and this is C1. So all of this is C1. And then when it enters the carotid canal, it's the petrous segment, or C2, right? And it gives off 2 branches. First branch, we see it's very tiny, right? It's the caroticotympanic artery, right? Because here is the tympanic membrane. It's lateral to the carotid artery. So this is the first branch. And then the second branch is the Vidian artery. And it enters through the Vidian canal and into the pterygopalatine fossa, which will have a separate video about the pterygopalatine fossa and the important structures that go through this fossa. So here we clearly can see the Vidian canal. The Vidian artery. So this is the petrous segment. In the petrous segment, we give off the Vidian artery, and we give off this small artery, the corticotympanic artery. And then we have the C3. It's the laceratus segment, because it passes by the foramen lacerum. So here we have the laceratus segment. It passes by the foramen lacerum just underneath here. If you can see it, it's a foramen between the sphenoid bone, the temporal bone, and the occipital bone right here. So it's this intersection, and it gives no branches. And then we move superiorly and interiorly. So here again, this is the petrous segment, and then we move superiorly and interiorly, and this is the foramen lacerum, and this is the lacerum segment, or C3, gives no branches. And then we get to C4, which is the cavernous segment. It moves through the cavernous sinus, right? And it gives two branches, the inferior hypophyseal, because this is the pituitary, and gives the meningeal branch. Let me just hide the temporal bone so it's easier to visualize. So here is the cavernous segment. So here we zoomed in a little, and this is the, so here it gives off, there's a trunk from the cavernous segment. It gives off, it's a meningiohypophyseal trunk, so it gives off the two segments that we, or the two branches of the cavernous segment, which is the inferior hypophyseal and the meningeal, and it's clear from the name. So here we have the first one, the inferior hypophyseal, and then we have the meningeal artery. Okay, this is from the cavernous segment. And then we get into the clinoid segment, which moves posteriorly, so it loops around the anterior clinoid process, right? So this is the anterior clinoid process. It loops around it and it moves posteriorly, right, to give the clinoid segment. So this is the clinoid segment, has no branches. And then we get into the C6, or the ophthalmic segment. So the ophthalmic segment will give two branches. So it will give off two branches. So this is the ophthalmic part. It will give off the ophthalmic artery, and this is the largest branch of the internal carotid artery. You might ask if it's larger than the middle and the anterior cerebral arteries. No, it's not larger, but this is a branch, while the anterior and the middle cerebral are end arteries. So this is the largest branch, the ophthalmic artery, and then we have here the superior hypophyseal. So here more clearly we can see the inferior hypophyseal from the meningiohypophyseal branch from the cavernous segment. And then after the clinoid, we have the ophthalmic, which gives off here the superior hypophyseal. So this is inferior, this is superior hypophyseal, and then lastly the ophthalmic branch also from the ophthalmic segment. And then at the end we have the communicating segment, which gives off the middle cerebral and the anterior cerebral, which are parts and arteries and parts of the circle of Willis. Hope this video was helpful, and see you in the next video.